because we know so much about the genetics of MS, we also know that genetics is not sufficient to explain all the occurrence of MS. And in fact, if you take monozygotic twins, only 40% of monozygotic twins are concordant for the disease. Despite them having identical genomes, only 40% of the time when one twin has a disease, the other has the disease too. So this strongly suggests that there are factors that are outside of the genetics realm, most notably environmental factors. And we know we've known for quite a while that there are environmental factors that influence the susceptibility of multiple sclerosis, particularly smoking. This is work from a number of MS registries, particularly the Scandinavian MS registries, and a number of epidemiological studies that have been done where they have established that smoking is a risk factor for MS. There's others, for example, the amount of sunlight that one takes in a lifetime, which can be converted into vitamin D. And then deficiency of vitamin D has been associated with as a risk for multiple sclerosis. And also most recently, the Epstein-Barr Virus infection. And this is something that we've suspected for a long time, that it might be one of the risk factors for MS, particularly because individuals with infectious mononucleosis were at higher risk for multiple sclerosis. And the difficulty was that Epstein-Barr virus infection is very, very common in the population. So although it was true that 99% of patients had been infected with EBV, also 95% of general population has been infected with EBV, so it was very difficult to tease them apart. But a recent study by Alberto Scario and Cassandra Munger at Harvard showed that utilizing samples from soldiers in the U.S. military that were taken over many, many years after they started their service, and some of them eventually developed MS. So those samples before they developed MS were critical to establish the causality of this infection with EBV. And so now this is probably one of the best established environmental risk factors. The latest element on the environmental factors is the role that the gut microbiome plays. And this is something that we're very interested in pursuing with the International MS Microbiome Study.